Hi everyone, welcome back to XGate Dental. I'm Emmanuel and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases. So don't forget to subscribe and follow to stay up to date, and let's get started. Today, I want to discuss a little bit about when we want to use immediate loading and when we can overcome the usage of immediate loading and still have some teeth for the patient. In many cases, we don't want to have immediate loading because there are chances for complications with the implants or a chance that the healing process won't be as good if we wouldn't immediately load. So what we have here is we have a patient. Before the implantations, we had a bridge on 2 teeth. He had 2 canines and he had the frontal bridge on the posterior part. He had partial overdenture that was connected to the bridge. So you have 2 canines, a small bridge, and a partial overdenture. He didn't use the partial overdenture, and he didn't have any use for the denture. So what we did is we took both of the canines. We made a new temporary bridge because the old bridge was a little bit problematic for the implantation, and we placed some implants. Now, in this case, we want to wait until the implants are osseointegrated. And then what we can do is we can remove this bridge, extract those teeth. We can add in the frontal area 1 or 2 implants and make another temporary bridge on those on the posterior teeth. This way, you don't need to mount any implants that are not osseointegrated. When the implant is not osseointegrated, the problem with the mounting of the implant is that the implant is in the bone only because of the mechanical holdings, because of the pressure that the torque that you inserted the implant into the bone. About 2 or 3 weeks after the implantation process, the bone starts to reabsorb and the modeling of the bone is starting. So this is the most crucial part of the osseointegration. In here, you can't mount the implants. The fixation of the implants in the bone is most fragile. So either way, you can't mount the implants right away, so you have immediate loading, or you can wait until full osseointegration. We don't have anything that we can do in the middle. Now, in this case, we were sure that you can make a bridge on those canines, and maybe you will. We will leave a permanent bridge on 2 canines and have on the implants from both sides 2 small bridges on the implants. Immediate loading is always taking some kind of risk, because if you make an immediate loading, you're taking a risk. If some kind of force is too strong on those implants, you will have a problem. And in this case, if you could place implants in the frontal area and on both sides and where the canines are, there's a chance that we could make an immediate loading. But if we can overcome it, we can place implants that will osseointegrate and we won't have any issue. We do prefer full osseointegration. For example, for a single tooth, almost always it's not a good idea to make an immediate loading because the forces are too big on the singular implant. If you have a full arch, you can have cases when you can immediately load. But the only advantage in immediate loading is the immediate aesthetics that you have for these patients. So, if you don't have an aesthetical problem and the patient has some kind of bridge and you can make implants, make the implementation and wait for the osseointegration, which is always a better choice. Because why do an immediate loading, right? Only because you want to have immediate good aesthetics. If you don't have any aesthetical issue or you don't have any aesthetic requirement, because if the patient is going with 2 canines and a small bridge for a couple of years, and the 3 months won't really be an issue. Now we have the osseointegration and we can take impressions on those implants that were osseointegrated. And then at the same time, we can extract both of the canines and add an implant or 2 in the frontal area. And this way, there's not even a single moment that the patient goes without teeth. In a week, we'll take out the stitches, we'll maybe take out the bridge and then put it back to make sure that everything is good, but there's not an aesthetical issue. At first, the patient was with a bridge, the same bridge that he had before. Then we just load the implants and all of the implants placed another implant or 2, extract the canines that wouldn't allow us to mount the bridge. And then the frontal part is not supported on any implants because we want to wait for the osseointegration, even though we already have most of the support from the posterior implants. So now we can mount on the interior implants as well. It's not a problem, but it's always better to have some kind of attachment if you have the place. You want to screw the bridge and you don't want the bridge to have any possibility to move in the frontal area. So in this case, for example, you can immediately load the 2 implants in the frontal area while the posterior implants are already osseointegrated. The biggest benefit that we have is we always had some kind of aesthetical solution, and we took the minimal risk for this. Patients in all of this restoration process. So you always have some kind of aesthetical solution and you minimize the risk of some kind of failure in the implantation. Thank you everyone who joined to learn some interesting and new information. Make sure to stay tuned for more, and of course, don't forget to subscribe, like, and follow. Thank you, and see you guys next time.